Masuwe, he'll be focusing more on our social response also, and HOD Tili Kasela, she's also talking on compliance and law enforcement. Without any waste of time, let me call upon MEC Maile to come and update us on our response, especially on social mobilization and the ward-based war rooms. Health is number last. Protection and namhlanje. Ward-based war room first.
Thank you very much, MEC Mazibugo. We want to take this opportunity to announce our ward-based war rooms strategy, which is based on the district development model. The district development model provides a strategic framework which all government work can be coordinated within the 3 spheres of government. And the district development model enhances service delivery and enables accelerated implementation of local development projects, incorporating all relevant stakeholders. In the context of COVID-19, there is a greater need to accelerate the implementation of the district development model, one plan for all 3 spheres of government, to better respond to the unique challenges that the pandemic has created. COVID-19 has necessitated a focus on municipal wards, especially in hotspots areas, as a critical aspect of government response to manage and contain the virus. The ward-based war rooms have strengthened our capacity to respond to COVID-19 challenges within specific communities, implement ward-based support and interventions informed by the ward profiles. The war rooms, ward-based war rooms, is based on our COVID-19 response to enable practical implementation of support to local communities and enable community mobilization and participation in the fight against COVID-19. At the ward level, community workers have been clustered according to the wards they work in and as per their respective sector portfolios, with a total number of 529 wards. 467 of those are active in the province. We have deployed 350 community development workers, 1,078 community health workers, and approximately 30,000 other community workers disaggregated per ward in the province. Ward-based war rooms comprise ward councillors, supported by other elected public representatives, such as MPs, MPLs, and through constituency offices and community workers. The ward-based war rooms provide oversight on service delivery in line with the 6 strategic pillars of our response to COVID-19, and that is the health response, the economic response, law enforcement and compliance, food security, social mobilization and state capacity and adaptability. Through the ward-based approach, we have been able to successfully implement the following in our districts around the province: screening, tracking, tracing, testing in line with established protocols, inspection of health facilities. We have been able to ensure enforcement and compliance in shopping malls, informal traders, mining houses, taxi ranks, and public transport facilities. Inspection of public facilities, including schools, clinics, home affairs offices, etc. community mobilization on the promotion of a healthy lifestyle, washing of hands, wearing of masks, physical and social distancing, support the District Command Council and respond to service delivery related matters. So those are the ward-based war rooms that we have launched as the Gauteng Provincial Government, and through these structures we want to localize the fight against COVID-19, and we want to make sure that these can work beyond the COVID-19 pandemic. Our approach is to mainstream and make sure that they also help us with service delivery matters going forward. Thank you very much, MEC.
Yes,
We'll now take our update on social relief. I'll now invite HOD Musue, who will actually share with us all the wonderful work that we've been doing as the provincial government. HOD.
Thank you very much, MEC, for the introduction and for the opportunity to present. During the lockdown levels that were here before level 2, the Gauteng government was continuously at work to make sure that we could provide for social relief in respective areas. And through the social security workstream of the province, we were able to provide a number of relief efforts as a means of mitigating against challenges that the people of our province would have faced. We concentrated our work among key areas, among them including food security and urban farming. In this particular regard, we can report that during levels 5, 4, and 3 of lockdown that we have had, we were able to reach 485,000 or distribute 485,000 food parcels that were able to benefit over 2 million families, 2 million people in our province. That's an extent to which we were able to deal with hunger challenges during the pandemic. We are also happy to report that during the same period, we were able to establish 73 community food gardens and expanded our food gardens to schools as well, in the context of getting 62 more food gardens at the school level. What these projects were able to do was further to give work opportunities or economic opportunities through the expanded public works program, and we had 200 people benefiting in all of the 5 corridors of the province in this particular regard. What also became important from a social security and social support point of view was that we had to continue with the sports, arts, culture, and recreation activities. But during this lockdown period, what became important is that we were able to see an uptake in e-learning. The readership began to be one of the biggest challenges, biggest benefits out of this province. We have seen the readership of online magazines increasing exponentially. And that also contributes to the basics that we are continuing to say, that we must become a literate and numerate society. We have seen an increase in the purchase of e-books, e-magazines, e-newspapers, etc. That also then confirmed that investments that the province had made in respect of digitizing and wanting to modernize the Gauteng economy was also beginning to pay dividend. From an education point of view, the question would be, were we able to provide for education? And we can report that we were able to get all, in terms of the revised school calendar. We do know that the grades that were supposed to go back were able to go back. We had our grade 7s going back and grade 12s going back. More importantly, we should also remember that the grade 12s, while COVID came, it caused an interruption in the system. But the grade 12s of this year have only this year to finish grade 12. And therefore, it's important to understand what it is that we have had to do. And we are happy to report that during this period, there were over 300 sites that we call supplementary sites, where young people in our province were able to walk in over and above going to school, and this is what we call the secondary school improvement sites. And we were able to get learners to participate at sites so that they could get additional tuition as a means of compensating for the loss of time that we would have had during the full lockdown. Not only were we concentrating on the grade 12s, we were able to make sure that we can provide support to learners in other grades through other means. Online support had become an important aspect that we dealt with, so was SABC radio and other online opportunities. But we also know that COVID-19 had brought a major challenge to the way things had been working. And therefore, we had to provide special attention to the vulnerable in our, and those that required care, as well as those that would have been homeless. We are reporting today, therefore, that through the interventions that government made, we were able to get a total of 4,700 plus people that received counseling and psychosocial support during the hard lockdown period. We were able to get to 5,900 older persons who could be accommodated in old age home and had to be taken care of. We were able to accommodate 1,800 persons with disabilities as a means of ensuring that we do not get them out of the streets. But more importantly, there were those that were addicted, and then we had to also make sure that we are able to remove them, help them manage the addiction processes, and 485 recovering addicts were contained and supported in this particular regard. We do know that during COVID lockdown levels, gender-based violence became a malady in society. And as a government, we were able to get 414 cases of victims that reported this, and we're able to remove them and get them into shelter. So this is an indication of the social services and social security responses that government had to deal with in the period. From a social relief, we are continuing to give you a breakdown in the context of when we say that over 2 million people were reached, where were those people? So we have given the breakdown in terms of the corridors. 531,000 of those people in the city of Johannesburg, 601,000 in Tshwane, 397,000 of those in Ekurhuleni, 334,000 of those persons in Sidibeng, in the Western 311, and we continue to give the breakdown in respect of. And remember that this work was done not only by the provincial government, it was work done by both the provincial government and municipalities working together, as would have been indicated. We also give a sense of where the shelters that we've been talking about, when we say we had to get the vulnerable people in our communities to be housed, the homeless, and all of those, we have also given you a sense of where the vulnerable people were housed in the province. And it is in this context that we will continue to provide these social services in our level. The big question begs now that we are in level 2, clearly, as MEC would have indicated, the number of people that are going to be back in the streets, back in communities will be very high. The question then begs, what is it that we are doing to ensure that as a government we are able to deal with this, with the increased the high levels of mobility that there will be? There are 3 key areas in the social sector that we had to pay attention to. Among those was the reopening of ECDs, because there have been complaints about what is it that we are doing with ECDs. We have had to pay attention to ECDs, the opening of sports, arts and culture service, recreation services, and education continuity. As it relates to the ECDs, one of the things that we did as a province was to begin to look into the assessment of each of the ECD sites. Remember, while we are at level 2 lockdown, it does not mean that there is no more possibilities of infections. And therefore, we have had to go into each of the ECD sites that we have, look at them and determine to make sure that they are able to comply with the COVID regulations and hygiene protocols that have been set. That is the one area that we've been looking at. And we are continuing with that through the Vangasali campaign, because we want to make sure that every ECD site that's open meets the necessary requirement and follows the protocols. In the same way, we also know that there are the sports activities have been open, although spectators can go. We also need to make sure that there are protocols that are followed in this particular regard. Hence, the processes of following on the applications in respect of ensuring that when those libraries reopen, that they follow proper protocols. We also know that from the 24th of August, which is on Monday, the greatest number of learners in public schools will be coming back. Now, with the greatest number of learners coming back, there are a number of things that education had to look at. Among them, we've always said safety first. If you talk about safety first, have we made sure that there are PPEs that are delivered? Schools must continue to ensure that they observe social distancing, that there is mandatory screening of everybody that gets into a school place, but equally, understanding that Gauteng has always faced high in-migration of people as a result having an impact in the number of learners that we have in schools. Many of our schools have high enrollment. If they have high enrollment, it suggests that to maintain social distancing, some schools have had to deal with ensuring that learners rotate as a means of getting all of them to come back, or we have had to deal with other methods of platooning or whatever the case may be. And it is in that context that all of these aspects have been looked into. In terms of the scope, what numbers are we looking at when we say we are in level 2? Level 2 reopening suggests that there will be close to 2,000 ECD centers that are funded by government that will be opening. There are 1,339 ECD sites that are unregistered that have been verified. And we are wanting to also reach 12,000 of unregistered ECDs through the Bangisali program campaign as a means of making sure that we get to these sites and make sure that all of these sites comply. From an opening of schools, we have had, on the 3rd of August, we had 102,000 learners coming back from public schools. We had 175,000 that came back on the 12th of August. We continue. Now, if we were to look at the total number of learners that are coming back on Monday, we are getting learners that are in grade R, grade 1, grade 2. We're also getting learners that in grade 9, grade 10, and in grade 11. If you add all of these numbers, we're looking at just over 1,500,000 learners that will be back into the system. And that is a big number. Social distancing still has to be maintained. Proper hygiene protocols still have to be maintained. And it is these plans that the department and the social security cluster of government have had to look at to make sure that we are ready to deal with. The last group of learners will come back as we phase in. Remember, this has been a phased-in implementation process. Now, from a phased-in implementation process, it means this last group will then come in on the 31st of August in that particular regard. We have given an indication that from a schooling point of view, since we reopened with grade 12s and grade 7s, we are happy to report that in Gauteng, 99% of our schools were able to open. So over the period of time, before the 24th, when many of the grades are coming, in the last weeks or so, 99% of our schools were able to open, and 78% of schools that deal with learners with special education needs were able to open. Those that were closed as a result of COVID cases that would have been reported, and therefore we had to continue to make sure that we provide support. We have given you an indication there of the total number of schools and the number of learners that would have been affected in each case. And we keep track also both of public ordinary schools or public schools and independent schools alike, because all children in Gauteng under our care are important. A question begs would be, during this time, what is the level of learner attendance? You can keep schools open, but the question is, are learners coming in? Are teachers coming in? We are happy to report that we have seen that our people are going back to work, and it's an encouraging sign, because we want to ensure that safety first principles are applied, and we can report, therefore, that 80% of our grade 7s were back at school. So is 86 in respect of the grade 12 as indicated on the figures there. So this is an indication of the type of work that we've been tracking. The health report will continue to talk about the COVID cases. We also, as a means of ensuring that we keep safety first, we track the cases that are reported and therefore refer them to the relevant areas. Lastly, we want to talk about, with the return of schooling from the 24th, it means we now have a revised calendar. With the revised calendar, we also know that there would be a level of anxiety. The Minister of Basic Education has released the final exam timetable for the grade 12s. The grade 12 exams for this year, the National Senior Certificate, which will also include the exams that were missed in June this year when there was hard lockdown, will commence on the 5th of November and will run up to the 15th of December. We will get marking of those exams starting on the 4th of January in 2021, and the results will be released on the 23rd of February for the matriculants. That is an indication of an extended school calendar that we're talking to. MEC, thank you very much for the opportunity.
Thank you very much, HOD Msue, for the update. Can we now get an update on law enforcement and compliance? We'll now invite HOD Chili Gasela, Matilda Gasela. Thank you very much, HOD.
Thank you, MEC. Good afternoon, MECs. Good afternoon, HODs. Good afternoon, colleagues and everybody. I think the important thing to say here is that government does not only have a responsibility to pass legislation and regulations, but government also has a responsibility to support those that it passes legislation for, but also to ensure compliance. And where there is non-compliance, to deal with such issues. So in that regard, there is a law enforcement compliance work stream that was or that is dealing with issues of compliance, but also enforcement of the compliance. Just to say that in terms of the achievements by government in this regard, we cleaned and disinfected about 742 taxis and taxi ranks. 18.6 million commuters were sanitized as at the 6th of August 2020. We also registered 12,865 learner transports, and of those, 11,844 were issued with stickers. We deployed 2,030 cadets to taxi ranks to monitor compliance in those taxi ranks. There were roadblocks at ports of entry into the province. In particular, we'll speak to the K78 road. At that roadblock, 3,988 vehicles were stopped and checked, and out of those, 757 infringement notices were issued for a number of offenses. We deployed patrollers at targeted schools, and 20 facilities were monitored as part of the ward-based battle plan, which MEC Maile spoke to, and a total of 120 facilities have been monitored as at date. In terms of education and social awareness, because it's also important that we educate our communities, we've done education and awareness training in the city of Johannesburg. Notably, we've been to Soweto, in Dobsonville, and also in Protectling Glen. We've also been to Ekurhuleni, in Primrose, Eden Park, and Brackenhurst. A total of 581 retailers were inspected in 271 malls and shopping centers, which were inspected as at 14th of August 2020. So one of our responsibilities was to go to shopping malls and shopping centers and ensure that there is compliance in respect of masks, of compliance officers in the various shops, in social distancing, and but ensuring that there's cleanliness and that there's no excessive pricing of food, but that food is also fresh in those shopping centers. We've given 11 statutory notices in some of those shopping centers to ensure that they do comply with the regulations. Park Station was one of our hotspots, and we did some compliance checks at the Park Station. What we've noticed is that 70%, there's been 70% improvement. But what we also had to do is to issue statutory notices, but we also wrote a letter to the CEO of Metro Rail. We've undertaken 21 inspections in the construction sector, and we found a facility which was non-compliant, and we issued the relevant notice to that as construction company. We also did 31 inspections in the manufacturing center with 81 facilities which were non-compliant. We also did the same in the agricultural sector. I think the question is, what is new with level 2 risk-adjusted strategy? As everybody knows, more businesses and facilities are going to be opened. In particular, we're talking about gyms, casinos, theaters, swimming pools. We are anticipating that there may be non-compliance, which we will also monitor. As everybody knows, there's going to be the sale of liquor and consumption of liquor, which is allowed on specific days. Again, we're anticipating that there may be a non-compliance, so it's something that will be under our radar. Level 2 allows for limited social gatherings in respect of weddings, social events at private residence, which allows for 10 people, at weddings 50, events at function events for 50 people, concerts at 50 people. So those are the issues that are going to be monitored by ourselves. We're going to be looking at non-compliance with safety measures in facilities like schools and gyms, as we've already said. What we're going to be doing is that we're going to have unannounced inspections, particularly in facilities which are our hotspot areas. We're going to be doing that together with business and commerce and also with labor. Like we said, there is a limitation of 50 persons, which we're also going to be monitoring. Again, there are going to be unannounced inspections to facilities which have got those gatherings. And again, we're going to be focusing on hotspot areas, and we'll be doing the business with the South African Police Services. We'll also be checking the sale of liquor and the consumption of thereof. Again, there are going to be unannounced inspections. We're going to be doing that together with business and commerce, but also with labor. The roadblocks are going to be following, are going to be continuing, because again, as everybody knows, there are still restrictions in that regard. So we are going to be ensuring that we continue with the inspections in that regard. I think, let me see, that brings the end to my presentation. Thank you very much.
Before I take health, On commitment to transparency and accountability, as the Gauteng Provincial Government, we are committed in ensuring that the investigations that have been started by the SIU are done in a manner that will actually make sure that it produces reports, and the SIU will continue doing its work. And we welcome the order given by the tribunal to bring assets of certain companies and individuals that are under investigation. Just last week, in keeping with our commitment to transparency and accountability, Provincial Treasury published a list of companies that were appointed to provide goods and services in support of our response to our COVID-19 pandemic. And from now on, Provincial Treasury will publish monthly reports on all the procurement done by the Gauteng Provincial Government. We remain vigilant and will make sure that even the number of daily cases and the daily admissions in our hospitals has eased, and the pressure on the health system leading to the relaxation of the lockdown regulations. And the relaxation of lockdown regulations enables the country to reopen the economy. Now, as we relax the lockdown measures, there will be increased movement of people, as I've indicated, and that we wish to urge our Gauteng residents to be more vigilant and continue practicing what we've been doing, the washing of hands, sanitization, and wearing of masks. And we wish to encourage all of us to play our parts. I now will want to call upon MEC for Health to be the one that will give us the presentations on the work that we've been doing as the provincial government, and how we've reduced our numbers, and how we have ensured that our healthcare system is functioning and it is okay. Can you load it from there? Okay.
Yeah. It's fine, MEC.
Pushange.
Yeah. We all know how to do it.
COO, ke wena o tla buang. Nna ke biditse MEC Makhura. Yeah.
Thanks, MEC. Thanks, MEC, and the MEC collective, HOD and the colleagues. I'll run colleagues through today's health report as just part of the weekly pandemic. And the pillars that are actually based in Gauteng COVID-19 response is based on are known. I'll be dealing with just one element of which is a comprehensive health response. Maybe just safe to say, I think where we are with the pandemic, of course, there's been over 5,999 confirmed cases with 4,977 recoveries, and unfortunately over 12,000 deaths to date, and of course with over 3 million tests conducted. New cases, 3,880, and of course colleagues will remember that this is quite lower than what we've been reporting. In terms of the national picture, which will continue to contextualize, Gauteng contributes the highest number of cases in terms of active cases in the country. We're contributing 33% of those cases, followed by KZN, and of course the Western Cape currently. We're sitting at, and of course also the same applies in terms of the number of recoveries that we have nationally. We are leading in everything else, of course, except the number of deaths. In terms of the recoveries, we are also demonstrating that of course contributing 34%. And this is something that we started very slow, but towards after going through the West, the numbers have picked up with over 169,000 recoveries recorded today. As far as, and that's of course compared to 17% contribution by KZN. And of course, this is the highest contribution that we have in this. So as far as the positive cases, recovery and active cases and the mortalities, I think it's common cause that Gauteng has already surpassed 200,000 cases. But what's encouraging about that is that in terms of, although it might be carrying the highest number of positive cases, we are also carrying the highest number of recoveries, which is something that is quite commendable, and it's something we must actually pound on, because the sign is saying that COVID is not a death sentence, and people do recover from the pandemic. So just to get a sense in terms of the levels of lockdown and where we are, just to give a sense of where we are last week, of course, we've had an increase in the past week of 7,135 cases over the past 7 days. And if you looked at the previous data, you will have seen those numbers generally would have been done over 2 days. So this has taken us 7 days to get those numbers. And we are internally of the view that we've got the wind behind our back and the worst is over. As you can see, the numbers are coming down quite rapidly. As far as it relates to the average cases per week, and I think that's the point I've been trying to make, that from week 19, which is actually that will be the middle of that curve, we've had a significant number of cases that have been decreased. As you can see, from 5,000 and odd, we've been going down since then. Of course, the numbers as to date, they are even under 1,000 daily infections that are being recorded. As far as the regional breakdown of COVID cases and recoveries, I think we've been consistent to say whilst we take the bulk of the cases, the Johannesburg Metropole has the highest number of cases, followed by Ekurhuleni and Tshwane. And what we are paying close attention to is, of course, the number of infections that are increasing in the Sedibeng area. As far as cases per sub-district, I think the details are provided on the screen, but safe to say that there are elements in Johannesburg, of course, in the Soweto area, in Tshwane, in the Atteridgeville area, including the CBD, and the details are there in terms of the number of cases and confirmed cases that have been recorded. But encouragingly, though, of course, is the number of recoveries that seems to accompany them. As far as the sub-districts and highest number of active cases, the details are provided there, but encouraging is that the numbers are also rapidly coming down, and this is what's encouraging, but it's also a reflection that the interventions and ward-based activities that the MEC made and also spoken to are starting to yield results, and this is something for the health system is quite commendable. As far as the cases per sub-district in the last 7 days, and I think the slides just highlights that although the numbers have been high, we have not been having them in the thousands, the highest being 711 in the area of Johannesburg, but then of course in the sub-district and in the metros, the numbers have been just close to 700 or so. But the cases are coming down, and for us that's quite reassuring. Of course, in the process of the pandemic, we have since lost 3,114 patients. And those amongst those, of course, the age group that will have been mostly affected is the age group between 49 and 89. And we have said previously that the males are slightly more affected than female, with a range of about 5 to 6% difference amongst those. And in terms of daily diagnosis and admission before death, and I think this is a message that we must also maybe punt a bit more, to then say a number of patients that arrive and demise in our facilities, they seem to be within the average of 1 to 3 days seems to demise, and from a public health point of view, there are concerns that some of our patients might be presenting themselves late and probably even ignoring the symptoms and of course not even testing at earlier time. And I think that's a call for us that to say, given the number of recoveries, patients that suspect of being COVID infected should present themselves earlier for a definitive care. In terms of the number of people that have demised due to COVID, of course there are several issues, the comorbidities that we know of, 3 of them being of course hypertension, diabetes, and retroviral disease. And just in terms of the percentage of those patients that will have demised, of course, hypertension is the biggest contributors, contributing 24% of that, and both those that will have hypertension and diabetes are about 19%, and diabetes alone is about 14%. But also the point we're also trying to drive home is that even patients with comorbidities also recover from COVID-19. As far as the NHLS provincial testing, as said yesterday, and I think the point that we're trying to emphasize here is that despite the numbers coming down, the province has not decreased the rate of testing that they are doing. As you can see, just to highlight it in your slides, that the number of tests that have been done have been consistent, despite, in fact, a slightly increase, despite the infections coming down, and that globally, in terms of nationally, Gauteng conducts 33% of the tests that have been done by NHLS. Of course, given the size of the population and the rate of infection, it's common cause. In terms of the management of the patients, the slide here, it's something that we take pride of as a public health system, to show that having gone through the peak of over 7,000 admission at one point, where the numbers have come down to about 3,311, and these numbers are decreasing on a daily basis. And of course, even those patients that are in the system, most of them remain very stable, either on room air, oxygenated, or even those that are ventilated, makes the quite significant, makes a very low contribution to them. The point that you also need to make in the slide is that the distribution between public and private in terms of patient admitted is almost equitable in terms of that distribution. Of course, that's a reflection of the ability of the health system to cover the patient, to manage the patient adequately. In terms of hospitalization, that's the point I was referring to, that at some point that around the week of the 19th, we're admitting over 7,193 patients, and significantly since then the numbers have sharply come down to the numbers I've just presented, and we hope at a certain point COVID-specific patients soon will be we'll hope to have them under 1,000 as soon as the conditions allow. Of course, in the process of managing the pandemic, as the rate of infection increases, our public health officials that are also getting infected, and out of the 172,000 public officials in Gauteng, over 7,000 of them, of course, have since tested positive, and including, of course, health workers that we previously reported, and in educators. Just in the past week alone, of course, we've lost some of our health workers, a switchboard operator at Kalafong Hospital, 3 nurses at George Mukhar, at Yusuf Dadu, 1 at Charlotte Mateke, and of course an operation manager at Charlotte Mateke Academic Hospital. And of course, over and above the health professionals, we've also lost 18 educators throughout the course of the pandemic. And of course, we as on behalf of government, we convey our sincere condolences to their family and friends. Like all other patients affected, and their families are continue, of course, to receive continuous psychosocial support in line with the treatment guidelines that WHO prescribes, and the protocols that are in place, and will continue to do that even beyond the pandemic. Of course, there is also a concerted effort to continue to decontaminate public buildings regularly, of course, in order to minimize the rate of the spread of infection, of course, also to comply with the prescribed numbers that are required per facility. This is just the slides just to indicate that we are on an ongoing basis monitoring our PPE stock, and at any given time we have a sense of what are the quantities for especially the essential items that are used on daily basis, and for various categories. And of course, we've got that grand total of what we have in stock. Of course, this is ongoing work, and this is actually live monitored on an Imbilo app, that we at any given time we've got a sense of what's there, what's the social, so that we proactively are able to intervene when the need arises. So this is just the indication in terms of what's the stock at hand per item, and these are just the details that I would leave them on the screen just for colleagues to deal with. But this is just to give a sense that there is an ongoing finger on the pulse as it relates to the number of PPE usage in the province, and then how we are managing. Of course, we've got over R1 billion worth of stock at hand, and it's something that we ensure that it actually arrives and lands where it's mostly required, which is where the patients and the frontline workers are. Thanks, MEC. I would end here, and I think there's Professor Mdaun that need to make some contribution.
last report is from Professor Gauteng.
Okay. We'll take our last report from Professor Mdaun, and she will share with us on the work that has been done by the Advisory Council as we continue under lockdown level 2. Thank you, Prof.
Good afternoon, MEC and everyone, and thank you for inviting me. What I'm just going to do is just to give the guidance on issues to consider for health information, education, and communication messaging as we move to lockdown level 2. I'm not going to go through this, but what happened is on the 17th of August, the whole country moved from lockdown level 3 to level 2. This means there's now further relaxation of restriction of movement. Many more people have to come back to work. They have to travel provinces. It's not permitted, and bars, restaurants, and leisure activities are allowed with some limitations. This means there will be more opportunity for people to interact, use public transport, resulting in the increased risk of spreading COVID-19 from person to person. Level 2 doesn't mean people can relax and stop taking precaution to protect themselves and avoid and others from COVID-19. Precaution referred to the NPIs or non-pharmaceutical intervention are even more important during level 2, where there will be more movement and interaction. What does it mean for communication and education messaging? We know that now NPIs are the only thing that can reduce transmission of the virus and help prevent other surge in COVID-19. What does this mean for messaging? It means we need messaging. We need more message that explain people how they, as individuals, can make a difference by applying NPIs at personal level. What need also to know, we know that people all ages, younger, and can be infected with COVID-19. Being younger, under 20, does not mean one cannot be infected with COVID-19. What does this mean for messaging? Targeted all people with the overall message. Need messaging targeting younger people, less than 20 years, so they do not think that they are immune for this infection, which people think so. All people must continue taking precaution and applying personal NPIs even during level 2. Messaging should specify that the behaviors of people should adopt NPIs, both to protect themselves, cleaning hands, maintaining physical distance, and to protect others, wearing masks. We also know that older people and people with existing medical conditions are more vulnerable. COVID-19 is more common in older than younger people. In Gauteng province, more in people between the age of 21 and 60 years. How does it mean? There is a need for messaging to target older people and those with comorbidities about what they can do to protect themselves. There is a need of messaging the broader public, individuals, communities, industries, public about what they can do to protect other people as well. When it comes to recommendation, what should people do all age to protect themselves against COVID-19? Maintaining physical and distance at least 1 meter from others. The frequent cleaning your hands with soap and water or with hand sanitizer. Insist that the windows are open when traveling on public transport. What should older people and those with comorbidities do to protect themselves against COVID-19? People over the age of 60 and those with comorbidities need to take extra precaution and avoid close contact with people. Stay at home. Do not leave the house unnecessarily. Work from home as much as possible, and employers need to support this. What should people do to protect others against COVID-19? We cannot stop emphasizing wearing a mask when in the presence of people and when in public. Everyone else needs to play their part in the protection of older people, such as avoid visiting your family members over the age of 60. If you have to be in the presence because you live together, it means maintaining a safe physical distance, wearing masks, wash hands, sanitizing, frequently wiping surfaces in the home with sanitizer. It also means no hugs and kisses. All those found to be COVID-19 positive should go into isolation at home or in a facility for 10 days. They must stop isolating until they're told so by health workers. When advised to go into isolation, people should actually isolate even if they may feel well. Isolating at home means staying at home throughout the 10 days, wearing a mask when at home, maintaining physical distance from other household members. Contact of confirmed COVID-19 positive case must remain in quarantine at home or in the facility. They must actually stay in a quarantine even if they have no symptoms. This means not interacting with older people or other people during the quarantine period, wearing a mask throughout the quarantine period, and maintaining physical distance from others. Most contact will have no symptoms and feel well. This does not mean it is okay to interact with others and carry on with normal social activities. Okay, thank you.
Thank you very much. Thank you very much, Professor Mtau. I'm sure you are ready now with your questions, clarity-seeking questions. And I'm sure that the MECs and the HODs and COO Malutane will be able to answer. Which media house first?
Let's see the ones that are here.
Oh, they're digital. Oh, baphucukile. Oh, I thought bafuna ukubuza 99 yazi. Yasezinye akulahlwa mbeleko ngakufela. Ningabuza sizoniphendula. Didijima sebe.
Okay.
Okay, thank you, MEC. We do have a few questions. The first one is from Network 24 from Arisa, and it's a few questions from Arisa. The first says, what will happen to the Nazareth facility or field hospital as the new equipment in this building now that the peak has passed? Will the other field hospitals like the one at the Tshwane Event Center still be built? And two, Gauteng recently released the names or the COVID-19 expenditure report, but the name of Royal Baka projects that is being investigated for alleged PPE corruption did not appear on the list. Why is this? How is the disciplinary process progressing against the suspended officials? When can it be concluded? Then the next question, the bank accounts of at least 39 businesses who were awarded tenders by the government are in the process of being frozen.
What is your comment on this? And how is threatening with a nationwide strike? How will this impact the Gauteng health system? With 40 contracts being suspended by the special tribunal, is the Gauteng government ensuring that their health workers still get PPE? Then the next question is from Alex Mitchley from News 24. Will the provincial government be adhering to the court order that restricts the payment of pension and retirement benefits to the former CFO? Then the other question here is from Makhura from SABC News. And these are two questions there. What do you make of the court order obtained by the SIU? I think it's similar to other questions that have been asked. How far is the internal disciplinary process against Gauteng Health's implicated officials in the SIU investigation? Okay, these are the questions. Let me just indicate the MEC did say in the presentation that we welcome the interim order given by the special tribunal to freeze assets of companies and individuals that are being investigated. This is a matter that is being dealt with by the SIU. So accordingly, we will not be answering questions about that. As we said, the SIU is investigating after we referred these matters to them. So the Premier referred the matters to the SIU. The SIU is investigating. They did make a commitment to keep the Premier informed of their investigations, and they are keeping to that commitment. And as and when there is progress, the Premier will be able to share that progress with the public. So we will not be answering any questions about the investigations. Questions about the freezing of assets can be directed to the SIU. So we won't answer those questions now. But the other questions, I'm sure MEC, the MECs will be able to answer.
It's mostly health.
Yes, MEC. Okay, before I hand back to you, MC, there's just another one for education. I don't see the person who, okay, it's from E-News, ETV News, from Ryan. And the question is, why has there been a delay in subsidy payment to ECD centers? Many last received their subsidy in March and have now let teachers go as they need money to employ them anymore or to keep them in employment. When will these centers or NPOs receive their money from the Social Development Department in the province? I don't know if the HOD will be able to answer this because we don't have the colleagues from social development, but I'll leave it to yes.
So there was no question on the work-based world. So we are happy about the rest of the thing. Well done. Let me start with HOD to respond on the subsidies for ECDs. And although ECDs, some of them are under social development. At school, but I'm sure it does have the response in relation to those subsidies. HOD?
Thank you very much, MEC, for that question. Government, there's got to be proper documentation and all of the related matters to be submitted. And what we do know is that the Department of Social Development had done some verification in respect of sites that had to be accredited and that had to receive the subsidies. But should there be any indication of sites that may still have been delayed in this particular regard, I'm sure that the department, through the necessary channels, will continue to be able to deal with those. What becomes important also from, and not only does it affect the ECD sites, and maybe we should also extend it to independent subsidized schools, because during COVID lockdown, the lockdown did not suggest that certain processes that were required before the lockdown did not have to take place. If a site is required to have governance structures in place, such governance structures must be in place in order that government would be able to pay. So in instances where you find government not paying and cutting on a subsidy, it suggests that the required governance processes need to be looked into, and therefore only on compliance with the required governance processes would such subsidies be released. And I'm raising this because we would also have had an instance in the system in education where there were subsidized independent schools that had wanted to be paid subsidies, but we had found that they had not complied with all the necessary processes. But we are in the process of managing that. And I think it will be the same in the context of ECDs, that all these are taken into account so that there is proper governance and fiduciary responsibilities in order. Thanks, Mr.
Professor Mkele from the HOD of Health will respond to all other health questions except those that are under SIU. Thank you. Prof.
Thank you very much, MECs, and good morning to everybody. Let me start with the question on the field hospitals. Having been informed by the burden of the disease, how it has behaved, and also inputs from the clinicians on the ground, the decision has been resolved and made by the Gauteng Provincial Command Council that we will not be expanding on any field hospital. Therefore, the Tshwane Event Center will not take place. With regards to the Nasrec Center, the Nasrec Center will remain as is because the scenario and the expectations are not yet defined, given that we may have another surge. But what is important there is that a number of those equipments which have been invested in there belongs to the department, and as and when everything is settled, we will repurpose them to our facilities. The next question relates to the impact of the proposed strike by NAHAU. Every withdrawal of healthcare workers in facilities is a challenge to the end users, the indigent people who use our facilities. So not only on COVID basis and also on the non-COVID people who use our facilities. We just hope that in the process there will also be consideration of the ethics which goes with that for those who are sworn to assist people. So we cannot judge at the moment, but certainly there will be some form of impact in that. With regard to the PPE now that we have stopped some of them. In terms of our current procurement of PPEs, we have reverted back into the method in which we used to procure PPEs. It should be reminded that before COVID, we actually used some of these PPEs, and facilities are going to be going back into procuring the PPEs using the transversal contracts and accepted methods of procuring the PPEs, as the emergency component part of it has passed away, has now lapsed. In terms of the disciplinary process of the officers and managers who are on suspensions, that process is ongoing, and we have the usual 60 days to ensure that it is completed, and we are on course in terms of that. MEC, those were the questions related to health, and thank you very much.
Unfortunately, all the bottle stores are closed, so you can't get your favorite malt. So yours just to go home and drink cold drink and tea. That then brings us to the end of our media briefing. Have a wonderful day. Remember to always wash your hands, stay safe, and make sure that you are not outside unnecessarily. And remember, there's still curfew from 10 o'clock to 4 a.m. So as jive use Naksha 10 before 10 10 actually so figure. So have a wonderful day. Siyabonga kakhulu nani lapha emakhaya nani bomsakazo. Bye bye.